Hi, welcome to the Sports Rehabilitation of Shoulder Injuries webinar. My name is Renata Ago. I'm working as a professional director at International Wellness Institute. Today, I would like to give you just a bit of teaser, just a bit of piece of cake from the sports rehabilitation course. My course is running in 15 countries at the moment. It's great for personal trainers, strength and conditioning coaches, physiotherapists, and also for doctors who would like to treat injured athlete around the world. Actually, during the course, we will go through all the muscle injury, ligament injury, tendon injury, fascia injury, and cartilage injury. Today, I would like to show you how you will be able to make rehabilitation for injured athletes if they have any kind of shoulder injuries. Actually, when you treat athletes with shoulder injuries, first of all, you have to know a lot about the biomechanics of the throwing, shooting, and hitting movement, and also about functional anatomy of the shoulder, because these two things is absolutely connecting to each other regarding to sports rehabilitation. First of all, when you meet with the athlete, you have to know which kind of injuries they have. Regarding to shoulder injuries, it could be rotator cuff injury, like a muscle injury, or even ligament injury or tendon injury, or it could be a biceps tendon injury, or maybe it could be anterior instability of the shoulder. So first of all, you have to know the nature of the injury. Secondly, you have to know which kind of sport they do. Are they doing hitting? Are they doing throwing? Are they doing shooting? Or maybe are they doing some kind of crawls because they are swimmers? Who knows? Maybe they are water polo players or handball players. And the biomechanics of the shooting, throwing, crawling are absolutely totally different. On the very beginning of the rehabilitation are always same. You always have to start with the test protocols. It's same for normal population. It's same for professional athletes. But later on, when you go on with the rehab, you really have to think about the biomechanics of the shooting, throwing, or hitting movement, because that's the main reason how you choose the proper exercises for your professional athlete in shoulder rehabilitation. So first of all, let's talk about functional anatomy of the shoulder. I would like to ask my assistant Eva to come in. And I would like to show you a couple of things what you have to think about when you start any kind of test protocol in case of shoulder injuries. First of all, you have to know a lot about the kinetic chain. Why kinetic chain is so important for us when we treat professional athletes? Because actually when they do any kind of overhead movement, everything is coming from the ground up till the most distal part of the shooting, which is the hand. So first of all, when you do any kind of test protocol, you have to assess, you have to examine the entire body, the entire kinetic chain. It has to be a postural assessment, because you have to assess your client in the more static position. Also, your protocol has to include overhead squat. You could ask why overhead squat is so important for us. We are talking about shoulder rehabilitation. Because, for example, if you have any kind of overused hip flexors, your athlete won't be able to throw and shoot properly. I'm not talking about the speed of the throwing or shooting. I'm not talking about performance. I'm just talking about the biomechanics of the shooting and throwing. So if your client, let me give you an example. If your athlete has a pretty tight hip flexors, they won't be able to stretch it and they won't be able to rotate it externally. They won't be able to stretch the entire anterior oblique sling, load, and explode. They won't be able to do it. And in this case, if the hip flexors are too tight the gluteus maximus won't be able to switch on. That means actually the entire thoracolumbar fascia and latissimus dorsi getting be tight, getting be overused. Later on, I will tell you the details why. And actually, in this case, your client won't be able to externally rotate the hip, the trunk, the entire shoulder line. They won't be able to load, pre-stretch, and in this case, they won't be able to explode. So that's why it's so important to ask them to do overhead squat, to see the ankle, to see the knee, to see the entire hip, the muscles overusage and underusage around the hip. Also, you have to know how strong is your core. Why the core is important. Sometimes we are talking about core stabilizers or core movers. Core stabilizers, as it said, is stabilizing the entire lumbar spine. The transversus abdominis just going all the way around. If you draw the belly button in, you will be able to tighten it up. Also, the core stabilizers includes the pelvic floor muscles just on the bottom. Extremely important, the other part is the diaphragm. And also there are 3 other muscle groups around the lumbar spine, which is also essential part of the core stabilizers. Multifidus, transversus spinal unit, and also the internal oblique, the posterior part of the internal oblique. This fact, the importance of the core stabilizer is going to be extremely important for us today. With core stabilizers, you will be able to fight against any kind of movement in all 3 plans. What does it mean? If I'm holding myself in the pull-off position and I get any kind of external pulling force, I try to stabilize my lumbar spine. I try to fight against the rotation. So I try to fight against moving my lumbar spine in transverse plane. The second most important exercise group is the anti-lateral flexion exercises. Same position could be, or it could be in a side plank, when you fight against the movement of the lumbar spine in frontal plane. The third one, anti-extension exercise. The best example for us is the plank. I know every one of you know it already. The plank, actually, when you fight against the gravity, because the gravity is pulling your lumbar spine downward towards the ground, and you try to engage, you try to maintain the perfect posture in plank. Also, the core movers are extremely important for us. The rectus abdominis, rectus spinae, which creates the movement. So actually, core stabilizers stabilizing the lumbar spine, and core movers create the movement for us. Flexion, extension, also quadratus lumborum, lateral flexion, and also for the rotation, the external oblique, extremely important. Why core is so important in case of shoulder rehabilitation? Because on the very beginning of the shoulder rehabilitation, when we're just talking about normal population, it's absolutely perfect if you do just isolated exercises. You do your mobilization exercises and some stabilization exercises. Some isolated exercises for the serratus anterior, some isolated exercises for the lower and middle trapezius, some isolated exercises for the external obliques. Maybe you do some kind of proprioception exercises, pulling, pushing movement. Also some throwing movement, but something is missing. Especially if you're working with professional athlete, extremely important to deliver proper functional shoulder rehabilitation exercise. Let me say post-rehabilitation. because it's not on the very beginning. You have to go through all the mobilization exercise, we will show you today, and also all the isolated strengthening exercise. But as soon as you finish, you have to add extra functional exercises into it, because it's extremely important to see all the exercises through the eyes of your professional athletes. When they go back to the pitch, when they go back to the water, back to the ice, then in this case, they will do the proper repetitive sport-specific movement, throwing, shooting, hitting, or even crawling. And if you just ask them to do some basic mobilization exercises, maybe on the floor, and some isolated exercises like a serratus anterior for the middle and lower trapezius, some external rotational exercises, proprioception, it's not enough. Because as soon as they're going back to the game, they will do functional movement, sport-specific functional movement. And actually, that's the reason why I told you in the very beginning, you have to know not only the nature of the injury, but also you have to know a lot about that sport-specific movement. You don't have to do it. You don't have to be a trainer of that sport, of that certain sport, but you have to know the biomechanics of that sport, because that's going to be your final goal to build it up. On the very beginning, when you start any test protocol, as I said, you have to do postural assessment. Checking the foot, checking the ankle, knee, hip, lumbar spine, trunk, also the shoulder line, and even the position of the head. From the lateral view, you have to check upper cross syndrome, lower cross syndrome. These two postural misalignments are extremely important, especially when we are talking about shoulder injuries. Why? Because of the kinetic chain. So, first of all, the lower cross syndrome means there is an anterior tilt in the hip. When the hip anteriorly tilted, the hip flexors are pretty tight. Tensor, iliopsoas, rectus femoris, extremely tight, overused. What the overusage means for us? Actually, overusage, in case of overusage, the fibers, the muscle fibers are pretty close to each other. There are extra crosslinks between the fibers, and the fascia around is pathological. That means it's pretty tight. The fascia layers stuck to each other. They won't be able to slide and glide on each other. There is no that much liquid between the layers. 70% of the proprioception is coming from the fascia. So, in case of rehabilitation, extremely important to optimize the state of the fascia. Because there is no rehabilitation, there is no post-rehabilitation or sport rehabilitation without proprioception. And that, as I said, 70% of the proprioception is coming from the fascia. So that's why extremely important to do the test protocol on the very beginning to see which muscle groups are overused, underused. In this case, if you have lower cross syndrome and your hip is anterior tilted, your hip flexors are pretty tight. They stuck to each other. Proprioception is pretty low. There is no that much neural connection. Nothing actually. It's tight, it's pathological around the muscle fibers. It doesn't mean it's strong. It's that it's overused, but it doesn't mean it's strong. It is tight. So you have to release it first and then stretch it. What does releasing means? If you're working as a personal trainer or a strength and conditioning coach, I'm sure you use self-myofascial release with the foam roller or even with a tennis ball or with a massage stick. That's pretty fine. But in case of shoulder, it's pretty difficult to use these tools these kits. So in this case, you have to use cups, you have to cupping techniques, special cupping technique. It's not only about soft tissue release, but also it's great for the mobilization of the scapula. Later on, I will show you how. Also, it's great if you can use flossing. Flossing is a compression band and extremely perfect for soft tissue mobilization and for compression, because as soon as you take it off, all the new fully oxygenated blood is just flushing through the injured area and speeding up the rehabilitation even more than just in a normal situation. So cupping is one of the great releasing technique. Flossing also perfect. And we can use also different kind of instrument-assisted soft tissue mobilization, like knife. Let me show you quickly what I'm talking about. Today we're going to use it a couple of times. So the knife and also the blade. There are so many different kind of shaped instrument-assisted soft tissue mobilization tools, but I choose these two for you today because these two are the best shaped for shoulder injuries. So, let's go back to lower cross syndrome. If someone has lower cross syndrome, as I said, the hip flexors are pretty tight. Gluteus maximus are underused. In this case, underusage means fibers are pretty far from each other, a lack of cross-link, so they won't be able to shorten and lengthen properly. The fascia around is also tight. So it is extremely important to do soft tissue release, even for overused and underused muscle. For overused muscle, we do the releasing technique in the direction of the muscle fiber. If you would like to activate the fascia, which is just stuck around the underused muscle, in this case, you have to do the treatment in 90 degrees, perpendicularly. So if you have lower cross syndrome, hip flexors tight, your client won't be able to, they will be able to lots of different kind of isolated exercise, but not the complex throwing or shooting movement. So the tight hip gonna lock the entire lumbopelvic hip complex. They won't be able to externally rotate the hip. They won't be able to do pre-stretch, nothing at all. So that's why the hip flexors are gluteus maximus extremely important in sport rehabilitation, especially in shoulder rehabilitation. In case of lower cross syndrome, core stabilizers, what I described before, are pretty weak, and the lumbar spine, the lumbar part of the erector spinae is pretty tight. What does it mean for us? Why is so important the lower cross syndrome if I have shoulder injury? Because actually, we have to talk about the posterior part of the functional line, or it's called posterior oblique sling. Why this line is so important for us? Every single school is keep mentioning it. It's called functional line or posterior oblique sling. There are so many different kind of names, but the meaning is same. It includes gluteus maximus, also the thoracolumbar fascia, and the latissimus dorsi. And on the other side, also the gluteus maximus, and it's going all the way up through the thoracolumbar fascia and the latissimus dorsi. One more little thing, which is extremely important. When this line is coming all the way up, actually latissimus dorsi just touch the inferior part of the scapula, and also there is a fascial connection between the latissimus dorsi, serratus anterior, and lower trapezius. And actually that was kind of like a magic sentence, because that's the thing, if the gluteus maximus it's not working properly. It could be overused, underused, can't switch on or can't switch on in the right time. In this case, the thoracolumbar fascia getting be tight, try to support the stabilization of the lumbopelvic hip complex. This fascial tightness is coming all the way up through the latissimus dorsi. And if the latissimus is getting be tight, the fascia around the latissimus is getting be tight, then in this case, it can move, it can replace the scapula. And that's the thing. If the latissimus is tight, replacing the scapula, some kind of scapular dyskinesis can go on. And also tightening the lower trapezius and serratus anterior also. Why is it important? Because actually, as soon as your client is pull the arm up, they try to do some kind of overhead movement. The lower trapezius and serratus anterior will help the scapula to turn out and up. But if the lower trapezius and the serratus is tight, because of the tight latissimus dorsi, because of the overused or weak gluteus maximus, in this case, your client, your athlete, won't be able to turn the scapula out and up in case of abduction. And your client try to compensate. I'm sure you saw this movement before when your client, not even your professional athlete, but your client on the gym floor did this kind of pulling movement, the shoulder elevation, stressing the upper trapezius elevator scapula. So before you start any kind of shoulder rehabilitation, you really have to think about the kinetic chains and how the kinetic chain affect on the shoulder rehabilitation, and shoulder injuries first and shoulder rehabilitation later on, because you have to build it in. So again, the functional line or posterior oblique sling includes gluteus maximus. The gluteus maximus is stabilizing the sacrum, the entire hip, lumbopelvic hip complex, one of the primary stabilizers of the lumbopelvic hip complex in sagittal plane. And as soon as your gluteus maximus getting be overused or underused, why is it happening? Because of anterior tilt or posterior tilt of the pelvis. The function of the gluteus maximus is going to be changed. It's getting be overused, underused, or maybe the hip, there is some kind of upslip, there's some kind of rotation, and the effectiveness is getting be changed of the gluteus maximus. In this case, the thoracolumbar fascia try to help and stabilize the lumbopelvic hip complex, getting be really tight. So that's why most of the time the physios build gluteus maximus activation test into shoulder rehabilitation, or even switch on sequence test or firing pattern. It's called firing pattern test as well, because they have to know what's going on around the lumbopelvic hip complex, what's going on with the gluteus maximus. So let's carry on. If the gluteus maximus is getting be overused in case of upper cross syndrome, or underused in case of lower cross syndrome, or it's getting be underused because there are some upslip in the pelvis, or maybe there are some rotation in the pelvis. In this case, as I said, the thoracolumbar fascia getting be pretty overused. It's not even overused, it's getting be really tight. Because try to help the gluteus maximus. This fascial tightness is going all the way up through the latissimus dorsi, both sides. As I said, the latissimus dorsi can change the position of the scapula. So actually, tight latissimus dorsi can tilt the scapula, which is pretty bad, especially when we are talking about professional athletes. Yeah, it decreased the performance, but it could be also reason of the injury. Why? Because if the scapula not in the right place, your client won't be able to create abduction in the glenohumeral joint. And in this case, every single time when your client goes up to do some kind of throwing or shooting, they're going to elevate the shoulder even more. There is so much stress on the glenohumeral joint, pulling it up, pulling their arm up, and they actually keep banging the head of the humerus against the scapula, which is in the wrong place because of the tighted latissimus dorsi and because of the overused or underused gluteus maximus. So that's why kinetic chain is to understand the kinetic chain, extremely important for us. It's not enough if you know there are so much kinetic energies coming from the ground reaction force. It's not enough if you know the gluteus maximus generate the 50-55% of the kinetic energy. It's a nice information. But for us, extremely important to understand the meaning of the gluteus maximus and understand the meaning of the functional line or posterior oblique sling line in case of shoulder rehabilitation. If your client has upper cross syndrome, I tell you a secret. If your professional athlete does some kind of throwing, shooting, or hitting or crawling movement, they will have upper cross syndrome for sure. Why? Because they keep doing internal rotation. And in this case, all the internal rotators like pectoris major, minor, latissimus dorsi, also the subscapularis and the teres major getting be overused because of the lot of internal rotational movement during the sport-specific movement. So it's not a secret at all. But you have to understand in this case, yes, these muscles are pretty overused. So the shoulder is rounded forward, the pectoris major, minor, latissimus dorsi, subscapularis, and also the teres major overused. All the retractors like middle trapezius, lower trapezius, all the external rotators of the rotator cuff, it's pretty weak and underused. But that's a fact. If you learn some kind of postural and movement assessment, you know all these facts. You know all the overused, underused muscle. But what you don't know is actually if you have upper cross syndrome, in this case, the lumbar spine and the hip start to compensate. What does it mean? There's going to be a posterior tilt in the hip, in the pelvis. In case of the posterior tilt of the pelvis, the gluteus maximus overused, hip flexors underused. What does it mean? It doesn't mean the gluteus maximus is strong. It's still weak. Won't be able to perform, won't be able to generate, won't be able to produce that 50-55% of the kinetic energy. That's a fact. But also, it won't be able to work and stabilize the hip and lumbopelvic hip complex in sagittal plan, which is extremely important information for us at the moment. In this case, the same thing gonna happen. Gluteus maximus getting be overused. I'm repeating myself. It doesn't mean it's strong. The fibers are pretty close to each other. There are so many extra crosslinks, and the fascia is pretty tight around. So the muscle won't be able to shorten and lengthen anymore. So all you have to do is the soft tissue release. You can use foam rollers, you can use massage stick, you can use tennis ball, or you can use even the knife or the blade or the cups, what I was talking about earlier. So in this case, the gluteus maximus is getting be tight. That means the overused gluteus maximus won't be able to stabilize the sacrum and lumbopelvic hip complex in sagittal plan anymore. So the thoracolumbar fascia will take over this function of the gluteus maximus, getting a bit tight again. And this tightness is going all the way up through the latissimus dorsi. So wait, what is it? What's this all about? So if I have lower cross syndrome or upper cross syndrome, then actually the thoracolumbar fascia and the latissimus is tight. Both cases, yes. That means both cases, if your client has lower cross syndrome or upper cross syndrome, that can affect of the shoulder injuries and shoulder rehabilitation and shoulder post-rehabilitation. So that's how the kinetic chain, especially posterior oblique sling or functional line by Thomas Myers Anatomy Trains, is actually connect to shoulder injuries and shoulder rehabilitation and post-rehabilitation. One more important thing. I would like to tell you a couple of things about arm lines. Thomas Myers in Anatomy Trains talking about 4 different kinds of arm lines. Superficial front arm line, superficial back arm line, deep front arm line, deep back arm line. Thomas Myers is great in myofascial chains, in Anatomy Trains. I really appreciate if you read his book. He's great. And if you read Thomas Myers Anatomy Trains, you will get better understanding in myofascial lines and myofascial release. Today, I just would like to give you just a bit of piece of cake from arm lines. In case of arm lines of Anatomy Trains, there is a superficial front arm lines, includes pectoralis major, also the latissimus dorsi, and all the forearm muscles here and the palm muscles. Which means actually, if you have any kind of shoulder injuries, extremely important to release the superficial front arm line first. If you have any kind of biceps tendinitis or tendinosis, acute or chronic tendon injury, in this case, you have to get deeper and deeper to hit the deep front arm line, which includes the pectoralis minor and the biceps. When we are talking about the superficial back arm lines, that includes the trapezius, upper, middle, lower part, also the deltoids, and it's coming all the way down through the extensors of the forearm. Why is it important for us? Because actually, let me give you just a bit of more information. All the tennis elbows connecting to the overusage of the extensors of the forearm. All the golf elbows, the injury, tendon injury, is connecting to the overusage of the flexors of the forearm. In this case, if you know all these arm lines by Thomas Myers, you will get better understanding how you should release all these muscle lines if you meet with elbows injury or if you meet with rotator cuff injury. Because actually, let me give you one more information. The deep back arm line contains the rhomboid, also the rotator cuff and triceps. What does it mean for us? That means actually you have to release the superficial back arm line first. You have to release the entire trapezius and deltoids to hit the deeper layers, which are the rhomboid and the rotator cuff muscles. So that's also extremely important to understand the importance of the arm lines. It's not enough if you just treat locally. If it's not enough anymore if you just do your rehab, your post-rehab locally. It has to be functional because you're working with athletes or you're working with normal population or normal people who was working out on the gym floor maybe every single day or few days weekly. So just a quick summarization. First of all, what you have to do is a posture assessment, not only in anterior view, but lateral view and posterior view. Also, you have to do different kind of shoulder range of motion test. You have to measure the flexion, extension, horizontal adduction, abduction with the goniometer. Also, you have to measure the external, internal rotation, because if you see any deficit in the angle, in the degree of the full range of the motion, then in this case, you have to do the correction. So the first main pillar is the test protocol. Posture assessment, movement assessment. Now you know what you have to find. Now you know your checkpoints. Now you know the connection between the posture and movement assessment to the shoulder rehabilitation. So posture and movement assessment, range of motion, and also you have to do the motor control test. The motor control test, which is actually just a kind of like a simple activation test for the muscles, will give you the information your client is ready for the post-rehab or not. Motor control test means actually you just assessing the activation and the strength of that certain muscles around the shoulder line. You have to give 25% load, 50% load, and 75% load against that certain movement, what that certain muscle creates. And if the muscle is functioning well against 25% load, 50% load, and 75% load, in this case, you will be able to carry on the post-rehab. But if that muscle, it's not active in that certain angle and can't create that movement in the full range of the movement, what it has to, then in this case, you have to stop the post-rehab and you still have to work on the isolated strengthening and mobilization. The second pillar is actually the correction. Yeah, I know you know lots of things about correction, how you can correct overused, underused muscle. For the overused muscle, you have to do some kind of releasing, like a foam roller, like a blade, like a knife, or like a cup, and stretch. Extremely important to understand when you do simple correction, then in this case, you will be able to use static stretching. But when we are talking about injured structures, injured tissue, then in this case, you have to use dynamic stretch. We are still in the second pillar. We did the correction for overused muscle, releasing and stretching. We do the correction for the underused muscle, releasing and isolated activation, but it's just a piece of the correction. You really have to treat the tissue around the injured area. What does it mean for us? That means actually, if you have, for example, a rotator cuff injury, it could be a tendon injury, like a impingement syndrome, or it could be a muscle injury, like infraspinatus injury. In this case, you have to treat the tissue, for example, around the scapula. I will show you later how. Also, you have to treat the thorax. It's one of the most important parts of the rehabilitation. So the correction is not only about correcting overused muscle, underused muscle, but you have to take one step further, even further. Do the tissue mobilization and joint mobilization. I will show you in a minute how. Many times when you typing the mobilization word into YouTube or into Google, most of the time you find soft tissue mobilization or joint mobilization. How all these two connecting to each other? If you would like to treat any joint, that means hip joint, shoulder joint, you have to release the superficial layers. You have to release the fascia. Secondly, you have to release the capsule of the joint. Why is it important? Because actually, when your client is keep doing different kind of external rotation, then in this case, yes, the glenohumeral joint and the rotator cuff going to be overstressed, but also the posterior capsule is getting really tight. And if you just treat the muscles isolatedly, or when you do some kind of mobilization for the glenohumeral joint or for the scapula, it's not enough, because the posterior part of the capsule is going to be still tight, overstressed. So you have to mobilize that one as well. So the first one, always the fascia, soft tissue mobilization. The second one is the capsule mobilization. And the third one is actually the joint mobilization. In case of joint mobilization, regarding to shoulder rehab, we have to talk about thorax mobilization, which is a thoracic part of the spine. We have to talk about scapula mobilization. And we have to talk about glenohumeral joint mobilization. So the first pillar of the rehab is all about the test protocols, posture and movement assessment, range of motion. It could be even a thorax mobility test. It could be motor control test, extremely important. Or if you're working as a physio or a doctor, you can add extra special tests into it. The second pillar includes all the corrective exercises. Firstly, you have to treat the reason of the injury. You have to treat the overused and underused muscle. Why? Because if you are not treating them, if you just don't care about the gluteus maximus, because I'm just doing shoulder rehab, if you don't care about core stabilization, in this case, your professional athlete is getting back to the training, to the game, to the water, to the pitch. And in this case, the reason gonna be still in the body. So they will be able to re-injure, which is pretty dangerous. So in this case, I have to tell you, if you are not thinking about gluteus maximus, kinetic chains, lumbopelvic hip complex, and all these things, how it connects to shoulder injuries, in this case, you won't be able to finish the post-rehabilitation successfully. That's pretty sad. Because actually, when the injured athlete is getting to the physios, most of the physios just try to focus on the located, they just do some kind of located rehabilitation. But what you have to do regarding to sport rehabilitation, regarding to functional post-rehabilitation, it's even on higher level, because you have to add extra functional element into it to hit the sport-specific movement, to reach the high performance level. I know most of you is not a strength and conditioning coach. Your task is not to be a strength and conditioning coach. Your task is not to do performance training. But your task, if you're working as a sports rehabilitation trainer, then in this case, you have to clean all the movements. You have to clean all the sport-specific movements and get the injured athlete back to the high-performance sport in even higher level than before, where they got injured. Thank you so much for your attention. I very appreciate it. If you're interested in participating on sports rehabilitation trainer certification course, you will be able to apply for it at our website. Also, if you're interested in certain topics like sports rehabilitation of shoulder injuries or sports rehabilitation of knee injuries, you will be able to find these kind of online courses on our website as well. Please follow us on Facebook and Instagram to see more from these exercises. Thank you so much for your attention. Have a lovely day.